So I'm John Geddes. I'm Professor of Epidemiological Psychiatry at the University of Oxford and head of the Department of Psychiatry here. And this series is called Understanding Mental Health. And it's a series we started thinking about and putting together with Dora Lowenstein and Saffron Weiss over a year ago, because we wanted to give people a chance to hear some of the experts we've got in our department about mental health, because there was an increasing understanding of the importance of mental health and a thirst for knowledge. And we're very fortunate in Oxford in having real experts, but also being at the cutting edge of research. But obviously then the pandemic came along and made it rather difficult to do the physical seminars and workshops that we've been thinking about. So we put together this online webinar version. And tonight is the first one, so we're very excited about it. And the department itself in Oxford is one of the large departments of psychiatry. And our focus, we've been around for about 50 years now, and our focus has always been on developing new treatments. We're trying to understand how mental health issues affect people, and then trying to develop and deliver new treatments. And certainly in my professional lifetime, this is one of the things that's really changed hugely. So when I was training, we used to talk about psychological therapists, for example, but you didn't used to be able to get them. And now increasingly we have access to effective and widely available psychological therapies. That's certainly the case for adults. And I think, as we'll be talking about a bit tonight, that's less the case actually in child and adolescent mental health, where we still know rather less about what treatments are effective, although as you'll hear from Kathy Cresswell later on, we are beginning to understand a lot more about it. Now, of course, one of the things that's happened over 6 months is that we have been affected by the COVID pandemic. This has really changed everything very, very quickly, because first of all, the department's research has become almost entirely focused on dealing with trying to understand what happens when you have a pandemic, both across the country and the effect you have on the population and different groups of the population. What's the effect of lockdown, etc. But increasingly, we're also trying to work out, well, what happens to people after they've suffered from COVID? What is long COVID? What are the sequelae of the illness? And so we're very active in research. And I was just talking to Kathy before this started this evening, that we've never been as busy as this. We're doing so much work, but hopefully we'll get some really good results out of it. So tonight we have Kathy Cresswell, who's Professor of Clinical Psychology at the University of Oxford. And she's going to do a presentation. She's in conversation with Mariella Frostrup, and I'll introduce Mariella a little later on. Kathy's been in Oxford for just over a year, and we were very keen that we wanted to build our research into child and adolescent mental health. And there was only one person I wanted to recruit to Oxford, and that was Kathy. So I was delighted when she agreed, and she and her team moved up here. And she's been absolutely extraordinarily successful since then, as she was indeed before that, because she was awarded the British Psychological Society Prize for outstanding contributions. And she's an absolute bundle of energy, and also is great at bringing together people very quickly to look at problems. So tonight we're going to hear initially from Kathy about child and adolescent mental health during the COVID-19 pandemic. And then Kathy and Mariella are going to have a conversation about the presentation, about that area of issues. Now, we will have an opportunity for questions and answers after. And if you do want to ask a question, then if I could ask you to put it in the chat function, and then I will select and sort of match and share the question and answer section later. So I think it promises to be very exciting and interesting and informative evening. Hopefully we will be able to get a good conversation going. We're all becoming quite familiar with this way of communicating in groups now. So it'd be good to get a little bit of to and fro in the conversation. But for now, I will hand over to Kathy to talk about child and adolescent mental health during the COVID-19 pandemic. Thank you very much, Kathy.
Thank you, John. I'm delighted to be here tonight and to help kick off this first webinar in this series. And I think across the webinar, you'll get a really nice flavour of the sort of research that we do in the Department of Psychiatry, and particularly the very practical impact that it has on people's lives. And as John said, I'm going to be focusing specifically on children and young people. And my particular research group is very focused on the development and evaluation of psychological treatments for children and young people. And as John said, we've been particularly keen to understand the impacts of the COVID pandemic on children, young people and families. And that was really important for us to understand, because even before COVID, we knew that we had real problems with mental health in children and young people. So in the most recent national study of the prevalence of mental health disorders in children and young people, it was found that almost 13% of children and young people had a mental health disorder. So what that means is they were experiencing a level of mental health difficulty that was having a significant impact on their day-to-day life. And actually, from 2004 to 2017, we saw a 49% increase in emotional disorders, so that's depression and anxiety, amongst children and young people, with particularly high prevalence levels amongst teenage girls. So there were already huge reasons to be concerned. And then, of course, COVID has brought enormous disruption to children, young people and families through the increase in potential threat in their day-to-day environment, the closure of schools, the disruption of exams, the interruption to social lives, and actually there's huge stress felt by many families due to the sort of need for sort of constant juggling of work and childcare commitments. So it's definitely been a very difficult time for families. So in order to understand that, within a week of lockdown, we launched a study called CoSpace, and we've now had over 12,000 parents and carers of children aged 4 to 16 years take part, and many of their young people, if they were aged 11 to 16, have also taken part. And we've been asking families to complete measures on a monthly basis throughout the epidemic, so that we can have a look at how families are getting on at any particular point in time, but also, and importantly, to see how things have been changing for individuals over time. So we saw very early on from our data that clearly lockdown was a very stressful time for families. So when we looked at our data in the first couple of weeks of lockdown, we could see parents reporting high levels of stress. And consistently throughout lockdown, we found that parents were really struggling with the need to manage work alongside childcare commitments. And we also consistently saw that their children's well-being was a top concern for families. And actually throughout lockdown, that was rated higher than, for example, their children's education. And obviously families had a lot of concerns during lockdown, particularly about friends and family outside of the household who they were not able to see. And it was really striking that when we were in the full lockdown period, nearly 2/3 of the parents and carers taking part in our study felt that they weren't sufficiently meeting the needs of both their work and their children. So what about change in mental health over lockdown? What did we see there? So we assessed 3 particular types of mental health difficulties: emotional difficulties. So here we're talking about anxiety and low mood; behavioural problems. So this is difficult behaviour, oppositionality, conduct problems; and also restlessness, inattention. So that's hyperactivity, impulsivity, difficulties concentrating. And what we found that was very striking was that when we look over the period of full lockdown, we could see that among primary school age children, we saw significant increases in all of these areas from early lockdown to a month into lockdown. However, it was notable that although we did also see these sort of problems with attention and hyperactivity amongst the secondary school age children, when we looked overall as a group, we actually saw a reduction in adolescents' emotional difficulties over a month of lockdown. So the opposite pattern there. And actually, particular groups seem to experience particular reductions in mental health symptoms. And we saw that particularly amongst children who had special educational needs, and also children who had pre-existing mental health difficulties. So it's important to stress that those children continue to have elevated levels of mental health problems. However, over the course of a month of lockdown, we saw those difficulties reduce somewhat. So those patterns were very much when we look at everybody together as a group. And the other thing that was very striking was that there's enormous variability in how particular children and young people responded to lockdown, with some thriving and others really struggling. And so who are the people who were struggling particularly? Well, this is something that we're continuing to look at and continuing to explore, but we've already seen that when we look at families on very low incomes, so those living on less than £16,000 a year as a household, we found that those families, children in those families were over twice as likely to experience significant difficulties with emotional problems and attentional problems particularly. And actually, we didn't see that the gap between those on lower and higher incomes widened over time, but they consistently had higher levels of difficulty throughout, which really, I think, shines a light on how pre-existing inequalities have continued to create risks for mental health problems throughout the pandemic. So from the study, we've been able to identify some of the patterns, and particularly some of the groups that have been challenged by the epidemic and all the difficulties that it's brought. So we've also been very keen to pursue research to try to address some of those difficulties for families. And a lot of our previous research has really highlighted how we can very effectively coach parents to be able to support their children. And particularly with pre-adolescent children, we've done a number of studies where we found that we can quite efficiently coach parents to be able to support their children within their home environment, and children can achieve really great outcomes when it comes to, for example, overcoming anxiety problems. So the first thing we wanted to do was to equip parents and carers and others who look after families to have good evidence to act as guidance for how to support children and young people. So we produced a number of evidence-based materials, some of which are shown here. And if you have a look at our Emerging Minds website, you'll be able to see both written materials and lots of webinars featuring a host of experts in their fields, giving guidance for families about how to support young people during these difficult times. And that was done with the Mental Elf, who are supporting us tonight too. And our research and our expertise has also informed other national initiatives. So we've contributed to the Public Health England Every Mind Matters campaign, which is now expanded to provide advice for families in addition to adults, which we're really delighted about. So I would also really encourage you to have a look at that. And ongoing work that will help us to continue to support children and young people and families in this time includes some recent work that we're just starting with funding from the Medical Research Council and the Westminster Foundation, where we're working with young people to create resources for young people that give them evidence-based guidance to help them deal with some of the current challenges. And we're also really excited to be starting a very large randomized controlled trial where we'll be delivering an online intervention to parents of children who are struggling with anxiety at the moment through National Health Service child and adolescent mental health teams. So where does this leave us? Well, I think the really important thing is that we have identified that many families have been struggling. We've also identified that many families have thrived, and actually in many cases it says a lot for says a very positive message about families and the ways that they've been able to support young people. So I think our next steps are really to make the most of this opportunity to really learn from this disruption, to work out how we can really try to make sure that young people have mentally healthy lives going forwards throughout the rest of the pandemic, but beyond into the future. So I'd just like to thank you for listening, and I look forward to chatting more about it. Thanks very much.
Thanks very much indeed, Kathy. That's terrific. And I think you've already highlighted the sort of, and I know you've only presented a kind of fraction of the findings. So presumably some of these will come out in the conversation that we're about to have. And we're joined now by Mariella Frostrup. So welcome, Mariella. Mariella is firmly established at the top of the UK's opinion-forming journalists and TV presenters, and probably needs no introduction in many ways. But she's currently helming her own show on Times Radio, And I think one of the members of our department, Mina Fazal, was on that just the other day, which was
She was indeed, and she was very excellent, contributing to a discussion very much around the same sort of topics of this, but also to do with schools and how they were coping.
So
thank you, John. Yes, I'm here.
Thank you very much. Thank you. So I'm gonna go again and leave the two of you to begin a conversation, and I'll come back and host some questions and answers. So thanks very much, Kathy and Mariella.
Apologies for the lighting and everything, everyone, but I'm not in my normal desk situation, so it's not looking very professional. Kathy, it's a pleasure to meet you via Zoom. And I know you probably don't want to do this, but I thought we could start just by talking a little bit about you and your interest in psychology. But first of all, perhaps you could explain, because you are a professor of developmental and clinical, or developmental clinical psychology, and
yes.
yet those are normally two different disciplines. So why are they married together like that, and what does that mean?
Yes, yeah, you're absolutely right. So there is very much a field of developmental psychology and a field of clinical psychology. So, and I trained as a clinical psychologist myself, so which is very much focused on understanding how to prevent and treat mental health difficulties across the lifespan. But really, for a long time, clinical psychology with children, in many cases, we've seen either treatments being delivered that didn't necessarily have a substantial evidence base, or were interventions that were being delivered based on evidence we had from adults, and just sort of seeing children as mini adults. And I think over the last sort of 10, 20 years, we've started to get a much, much better understanding of how we need to integrate developmental psychology. So an understanding of how children's thinking differs as they grow, but also how environmental influences on children obviously differ in terms of peers and parents and other people around them and the other experiences they have. So in clinical developmental psychology, we try and really bring together those two fields so that we can really make sure we can develop the best treatments for children, taking account of their stage of development and the environments that they live in.
So what sort of treatments would be non-evidence, not well evidenced for success? What sort of treatments would they be?
Yeah, so, so I suppose if I focus more on where there is evidence, I suppose that, to be honest, there are lots of areas where we don't have extensive evidence. So whereas for adults, we now have NICE guidance, which is the NHS sort of guidance where they, a panel will have a really rigorous look at all the evidence and pull together guidance for that. We have a very small number of guidance documents that talk about what we should be doing in for common mental health problems in childhood and adolescence. We're just starting to see that grow now, but we've just generally had a lack of evidence base because we haven't seen the same sort of randomized controlled trials and these sort of approaches being used to really rigorously test out interventions. So it's not to say what people were doing didn't work. It was really that we didn't know whether it worked because it hadn't really been tested properly.
And is that what led you into the field, the fact that there was such a big space to be filled in terms of knowledge, both developmental and clinical?
Yes, exactly. I think I was really inspired by a lot of the work that had been done, particularly in Oxford, actually, by psychologists developing and evaluating psychological treatments that are now really effective and used very widely around the world. And it really felt like we weren't in the same place for children and young people. But there are, studies that have suggested that 75% of adult mental health problems start before the age of 18. So it's obviously critical that we are able to identify these difficulties early and offer treatments that work. So it's really that kind of pushes forward all of the work that I do and that my team does to try and make sure that we can get treatments that we know work to people when they first need them.
You mentioned some startling figures in your talk. 13% of 5 to 19-year-olds had a mental health disorder in 2017, which is a 50% rise on 2004. Now, either something really cataclysmic happened in 2004, or it was when we started looking forensically at children's mental health. What is the reason? Why is 2004 this sort of benchmark moment for children's mental health?
So I suppose an important thing to say is that it wasn't a 50% increase in all mental health difficulties. It was the 50% increase was specific to the emotional disorders, so anxiety and depression. Actually, the prevalence of other sorts of mental health problems actually stayed quite stable. So you're right, it's really striking that we saw this really quite big uplift in anxiety and depression in children and young people. And I suppose the data that we have starts in 2004, but we haven't had annual measurements. So we've then had some big gaps that have brought us up to 2017. So it's not possible to track exactly when these things happened. And there's obviously a number of questions about why we've seen this big increase. And people often ask, is it because we're more aware? And certainly lots of families we work with tell us that actually other people in the family had these sorts of difficulties, but nobody ever thought anything of it. But actually the study that I mentioned used very robust measures, which we can feel pretty confident in. And I think really does give us a clear message that there has been an increase. So I think, and I don't think we really know exactly why. There are lots of hypotheses that are out there about that. But, I think often people talk about social media as being something that's changed. But actually, we've got some really interesting data from the CoSpace study that I mentioned. And one of the things, obviously, I referred to was that actually when we look overall at the adolescents in the study, we saw this slight reduction in mental health symptoms. We don't know exactly why that was, but one thing that was striking was that in our study, over 80% of the adolescents were having regular contact with peers because they had access to the internet. Whereas for the primary school children, who seem to be doing much worse, only about 30% were having regular contact with peers. So I think, often these things are pinned on social media, but actually it's possible that through lockdown, the access to the internet was a bit of a lifesaver for many and was really very helpful. So I think we need to look really broadly, a whole range of things that could be contributing to that change over time.
I think we'll go on to talk about lockdown in just a second, but just more generally, and taking that sort of 2004 benchmark, I did notice that it was about 4 or 5 years after smartphones became very widely available. And I wondered, you say that social media, has been, deemed to be a contributing factor. And I think a lot of people would argue that it has to be, could it have anything to do with the fact that younger children are less able to cope with it, whereas older children have grown up with it and are now in a slightly better, perhaps they understand it better?
Well, I think in our study, the younger children, it seemed like actually a lot of them didn't have regular access. So I'm not sure that was the factor there. But I think it is a really interesting question about, actually if there are impacts of smartphones and internet access and all those sort of things, are they changing over time as the nature of how young people interact with that sort of media changes? And also now that they've grown up with it and they know, they know a bit more about how it works. So I think, there are definitely lots of interesting questions to pursue there.
I'm sure there's lots of parents listening who are interested to know, even if it's hypotheses, why it should be that children's levels of anxiety and their mental health in general should be on forgetting COVID just for the moment, on a sort of a downward trajectory, or at least on the increase, in terms of how they're responding to the world around them in life. It's fascinating to me as a parent that, as a child of the 1970s, when parenting we all thought couldn't get any worse. Yes. That now that we're all supposed to be so much better at it and so much better informed and so much more intuitive and so much more understanding of what our children need, that our children are actually less resilient than they were, when we were left to our own devices for 7 hours a day and parked outside pubs while our parents went in for a drink.
Yes, yeah, no, absolutely. I remember that very well, very well. Yeah, and I think obviously there's been a number of things that have changed, which we need to take account of. So one is obviously things like social media that get a lot of attention. Obviously, over that period, families have experienced austerity, and we've seen increasing inequality, and we've seen a lot of changes also in the education system. And I think the fact that we saw this sort of slight improvement in mental health over lockdown in the teenagers was quite telling. We were being very cautious about that finding because we didn't have data from pre-lockdown. But actually, there's now been another study from Bristol, which did have data from before lockdown, which they've compared it to for year 9 students. And they found that during lockdown, those year 9 students were reporting lower levels of anxiety than they were a year before when they were in school. And similarly, Mina Fazel, who you mentioned, that in their recent school study, they also found a sort of, fairly even distribution, although it differed slightly at different ages, between some children and young people who clearly felt that lockdown had a negative impact on their mental health, some who really weren't phased either way, but also a clear group who really felt they'd benefited. And so the combination of those studies also does raise lots of questions about schools, how we do education, and whether we're doing it in the most sort of mentally healthy way for young people.
And what are your thoughts about that?
Yeah, so, well, these are completely non-evidence-based thoughts. So, I mean, I think certainly, I've got a 16-year-old myself who's just not done GCSEs. And I think, we could definitely see that it did seem that there was a lot of build up to the exams where as if this moment of GCSEs was of all, completely critical. And that was what everything was about. And the whole 2 years was about working up to that moment, rather than thinking about all the other things that they could be developing and learning during that time. And so I think that is something that we need to think a lot more about, is about how we do education, the messages that we're giving to young people, what we're valuing, the amount of pressure that comes from the way that we approach education.
And talk to me about how you approach children's mental health differently from adults' mental health. Because that's obviously the reason that this kind of differentiation has started. I sort of feel like I'm quite animated about the fact that medical testing has been done primarily on men for the last 50 years, and so the way women are medicated it tends to be just in the sort of spare rib theory, where we're just a smaller version, so we just give them a little bit less of that, with sort of total disregard for our physiognomy. And it feels that perhaps until quite recently that the same sort of thing has happened with children, in that they've been diagnosed and treated in much the same way as adults. So how do they differ, and how should we differentiate?
Yes, yeah. So we try to do a lot of work to try and test out how our theories about our thoughts and our behaviour and how they influence our mood, how those might vary over time and through development. And so, for example, a lot of our treatments for anxiety disorders are based on cognitive behaviour therapy, which is all about being able to develop new ways of thinking and new ways of interpreting situations. So in order to change your mood and how you respond to situations. And so the assumption there is that how you think about things is the driver for what you do and how you feel, and you get stuck in vicious cycles. But there are studies that look across development that suggest that actually, that with younger children, unsurprisingly, actually it's the experiences that they have that inform how they think and what they do. And it's only actually as they go through childhood and move into adolescence that those kind of thinking processes become more stable and then start to have a life of their own and influence mood and influence behaviour. So it might be that at certain stages in development, rather than our treatment being all about helping children to test out how they're thinking, we need to be much more thinking about the environment around the child and how that's contributing to how children are thinking, or other parts of their experience, and working that way to help them to gradually develop different ways of thinking and approaching situations. I'm not sure if that makes sense.
Yeah, no, that makes sense. You said, speaking about the environment around children, you said that during lockdown and during this sort of pandemic period, there's been, you've registered a marked difference between the low income and higher income families. Is it for very obvious reasons, or are there contributing factors there that you don't understand? Just talk it through for me a little bit.
Yeah, so we need to look into it much more. This is something that we've really very recently pulled out of our data, actually in response to some questions we had from the Department for Education. However, we did see that among the low income families, among the secondary school age students, actually the low income families, those teenagers were actually a lot less likely to be having regular contact with their peers. So that's one factor. Obviously there are likely to be far more stresses in the family about generally about money coming in, employment and so on. And so those are two factors that we definitely need to take into account going forwards. But I think what we found is important to highlight is that the gap didn't widen. So those children were at increased risk at the beginning of lockdown, and they continued to be throughout. So it wasn't that lockdown suddenly created a risk. The risk was already there.
It's interesting though, isn't it? Because you'd imagine that some of the factors that you talked about there, you know, the awareness of money problems and those sorts of perhaps more adult stresses, as it were, would be more noticeable, more prevalent amongst teenagers. And yet you also had this decline in the number of teenagers experiencing emotional problems. Do you have any idea why that might have been?
Yeah, so I think that the decline, from what we've heard from families, and this is something that we are exploring further through interviews with families, but we're certainly hearing from a lot of families that their secondary school age students did feel that a lot of pressure was lifted from not being at school. And the other thing that we see in the primary school age children, well, you know, and as we said, they also were quite connected generally with their peers, certainly the young people in our survey. But when we look at the primary school age children, we also see that obviously they're going to be much more dependent on parents during lockdown. And we found that the parents of primary school age children were much more likely to say that they weren't managing childcare and work at all. And much less likely to say that they really were, whereas the parents of secondary school age students, I think, you know, probably had it a lot easier in many cases in terms of, you know, just the minute by minute childcare, and those parents were much more likely to feel that actually they were managing work and childcare. So I think there were a number of factors. So the older ones, maybe there were less pressures from school. They also were connected with peers in many cases. Families seemed to be less stressed overall, whereas for the younger ones, we were seeing much higher levels of parental stress from the juggle and less connection with peers.
In the conversation that I
Kelly
had,
and Mariella, I'm sorry, I'm just gonna break in if
one last question.
One last question.
In the conversation that I had with Mina the other day, you know, one of the things that was, and I'm sure she didn't say it, so I don't want to lay it at her feet, but one of the things that she, that we all talked about in this discussion on Times Radio was the fact, the sort of damage sustained during this period, and that in periods of emotional distress for children, like let's say a bad divorce of parents and things like that, that often it can take 10 years for the symptoms, for the sort of outcomes of that distress to start to really show. And I wondered if you feel that the damage that children are sustaining during this particular period of pandemic, whether we have yet to see the sort of longer lasting impacts of it, and whether there is something that we can do about it now to prevent that from happening.
Yeah, I mean, I think it's a critical question, and I think it's going to be really important that we are continuing to track the impacts on children and young people, because you're absolutely right. Many of them we may start to see later on. And I think in terms of what we can do to try and minimise the impact, I think, well, the first thing is obviously keep a really close eye and for us to keep tracking it. And I think, for us as parents and friends and so on, it's about really trying to create opportunities for open conversations where we're curious, we show that we're interested, we're empathic, we understand where young people are coming from. So we're just opening the doors to those conversations. And then if there are difficulties, really not being shy about going and finding information. So I mentioned a few sources early on, the Public Health England site, our Emerging Minds site, are really great places to go for people to find evidence-based information. And then I think if things go beyond that level, it's really, again, about not holding back, about going and asking for help. And child and adolescent mental health teams, they are open for business at the moment, and will continue to be, and have been working really hard to find ways to keep working with families. So I think it's really about that three-stage approach: keep an eye and have conversations, get information, get support if it's needed.
Because a remarkable 40% of families with children displaying mental health difficulties don't actually contact anyone about them. Isn't that
Yeah,
right?
absolutely. That's right. And what we found for anxiety disorders specifically, even higher numbers than that. And there can be so many barriers. You know, often parents are worried. You know, is it me worrying, or is there really something going on? Worried about the reception that they'll get. Worried that they'll go to all that effort and then nothing will happen. You know, or maybe things will just take care of themselves. And so there are lots of barriers there for families. So you know, we really are always really keen to encourage parents to just go for it anyway. Try to put those things aside and ask for help when it's needed.
Sorry,
So
John, I
Mariella,
cheated.
thank you so much. I mean, quite honestly, I feel really bad interrupting because I could listen to that all night. So many fantastic questions. I think really getting to the heart of, you know, what for me, you know, talking to Kathy and other people in the department, we've just, okay, there's been lots of things that have been bad about this pandemic, but my goodness, if we do the research during it, we learn so much that is more generally applicable. Not just the fact that, you know, children and adolescents aren't just mini adults, but also the complexity of the way that people respond. And for me, we're just beginning to understand just how big a job this is. You know, this issue about whether schools are increase anxiety, it wouldn't surprise me at all if they did, because I'm not sure that we're training or teaching or nurturing children these days to cope with this really complex world. You know, we still have a largely traditional curriculum. So it raises all these kind of questions. There are a few questions coming up in the chat that I just, because, you know, it would be really good, Kathy and Meryl, if we could just have a look at some of those. I mean, I think that Anne Dowker was asking questions about, specifically about this issue about school and whether it's the environment of school that actually, in a way, we're protecting children and adolescents from at least some. And I think you probably explored that. And, you know, I think there's also this issue about assessment and pressures of, you know, academically, and I think you mentioned that as well, Kathy. Like you, I'm a father of a daughter who didn't do her GCSEs but seemed to get them anyway. And that caused its own anxieties, but obviously she wasn't going in every day and doing the same volume of homework. Julie Lynn Evans asked, did you see an increase in eating disorders in your study at all?
Yeah, so in our particular study, we didn't actually assess eating disorders. We just looked at those very broad headings that I looked at. And because of the nature of the study and the way that we did it, we had to be a little bit careful about the things that we asked about. However, I am aware of other studies that are specifically looking at eating disorders over this period. And I haven't heard the outcomes from those yet. So that is something that we'll be watching carefully. I mean, certainly one of the challenges for over this period has been for where people are experiencing significant difficulties, feeling that they're able to go and get the help that they need. And certainly we have seen in clinical settings some situations that have gone to a crisis situation where maybe ordinarily they wouldn't, because people would have felt more able to get the support that they needed. So that's something that we need to be really careful about. And I think some of these things, like eating disorders emerging during the lockdown period, we're going to probably start to see the impacts of that now, as people are starting to go to the doctors more and seek help more, and certainly so I think we're going to get a better understanding of that over the next month or so.
Thanks very much. We may only have time for one more question, but there is, and I've seen a couple of questions that are on related issues, and there are some children who are in care, for example, and could you study their needs? And there are some children, we saw this actually, this is a question that was submitted before tonight's webinar. There are obviously some children are in families that are separated, and that might have caused particular problems. Were you collecting data on those particular situations?
Yeah, we were collecting. We've got a reasonable sample of young people have looked after children within our study, and so that is a group that we will be able to look at in much more detail as we go on. And we also have just started to look at single parent households, and the pattern was really quite similar to the pattern that we've seen for other groups who are in particularly challenging circumstances. I think, like you say, you know, for a single parent on their own with children during that period of full lockdown, and obviously there were lots of challenges in terms of early on, it was very unclear how to navigate contact with other family members and so on. You know, it was all a bit slow to become, you know, clear, I think, for those families. And we've certainly seen that we have seen increased difficulties amongst children and young people in single parent families during the lockdown period. And so we do know that it was a particularly stressful time. And we're really keen to work with charities such as Gingerbread to really think about, on an ongoing basis about the needs of those families.
Well, thank you so much, Kathy. Thank you very much, Mariella, for that wonderful questioning and conversation with Kathy. And I do hope that the audience enjoyed that talk, that webinar tonight. And thank you very much for coming along and spending this time of the evening with us. There will be a chance to watch this again because we're recording it, so it'll be available online. And like I think I said at the beginning, this is the first of a series. So this is our first time around. So we'll be sort of tweaking the format and making sure it works okay. But we've got another talk coming up, another webinar coming up with Adwera Abwa and Rebecca Sheriff on Tuesday, the 6th of October. And we'll be sending out more information about that in the meantime. And lastly, I do just want to thank again Dora and Saffron for putting all this together, and also to Andre and the Mental Health for delivering it from a technical point of view. So thank you very much, everyone, and good evening.